The hearing will come to order. Senator Grassley is here and nearby, but I've been cleared to begin my opening statement. So I will begin, and then we will recognize Dr. Gupta. Oh, here he is. We lost over 107,000 Americans to drug overdose last year, including 453 Rhode Islanders, a painful reminder of the massive challenge ahead in addressing drug trafficking and substance use in this country. We must do better. The Office of National Drug Control Policy, ONDCP, has a comprehensive plan with ambitious goals to meet by 2025, including a 13% reduction in drug overdose deaths, doubling treatment admissions for the populations most at risk of overdose death, a 25% increase in the number of peer-led recovery organizations, doubling the portion of federal inmates with an opioid use disorder who can access MAT, a 25% increase in active investigations targeting the Sinaloa or Jalisco New Generation cartels and their enablers. These goals, developed with input from National Drug Control Program agencies and others, hold promise to turn the tide against the overdose epidemic. Several priorities deserve particular focus. Prevention efforts are cost-effective and life-saving. The longer we can delay the age of first use of illicit drugs, the more likely we are to prevent addiction. Bolstering these programs is a smart place to start. Treatment and some harm reduction efforts are also effective. Medication-assisted treatment and overdose reversal medications save lives every day. But most Americans who need treatment for substance use disorders don't receive it. This has to change. We must build the treatment and recovery workforces, establish best practices for recovery, and ensure a dedicated funding stream for recovery programs, and the strategy recognizes this. Equally important are treatment courts and deflection programs which connect nonviolent drug offenders with treatment in lieu of incarceration and reentry programs. I'm pleased that the strategy prioritizes these programs, and I hope that ONDCP will use the best practices of Rhode Island programs, such as the LEADER program and the Rhode Island Department of Corrections MAT program as national models. My bipartisan bills, CARA 3.0 and the TREATS Act, would boost the prevention, treatment, and recovery infrastructure and permanently allow for medication-assisted treatment via telehealth. I look forward to seeing these bills enacted. We must also hold drug trafficking organizations accountable. Multi-jurisdictional task forces that target drug trafficking organizations have proven effective. Boosting such law enforcement work would be wise. Most of the drugs Americans consume come from elsewhere. Mexican cartels source precursor chemicals for fentanyl and other illicit synthetic drugs from China and India. Colombia remains the primary source of cocaine consumed in the United States. That all means we need to strengthen international partnerships with law enforcement abroad. We can reduce the flow of precursor chemicals and finished drugs crossing our borders and hit drug trafficking organizations where it hurts them the most, which is their wallets. As long as cartels and their enablers can turn a profit, addiction and overdose deaths will continue to rise. So I'm pleased that strategy includes goals to increase the number of financial investigations into cartels by using suspicious activity reports and to increase financial sanctions against members of some of the most dangerous cartels. I'm disappointed in some of the ONDCP's choices. Cartels thrive where the rule of law is weak and where corruption can flourish. We should help partner nations combat corruption and strengthen important institutions like courts in jurisdictions that traffickers exploit. So it's disappointing to see ONDCP's 2023 budget request include a 16% cut to international programs that could help to address these problems. Still, this strategy offers ambitious goals and welcome changes. We'll need to carefully measure success, as I'm sure GAO will discuss. Right now, for instance, we don't have timely reporting of fatal and non-fatal drug overdoses or a reliable baseline for basic information like how much money we have denied and seized from drug trafficking organizations or the number of related prosecutions. This kind of information is critical to measuring the strategy's effectiveness. I applaud ONDC for recognizing the woeful inadequacy of our current systems, and I'm counting on them to help us turn the corner. The stakes for the successful implementation of this strategy are high. ONDCP has set goals which, if achieved, will prevent tens of thousands of deaths over the next 3 years. I look forward to hearing about how ONDCP will implement its strategy and how it will hold National Drug Control Program agencies accountable for reaching the strategy's goals. I also look forward to hearing what GAO has to say about the strategy's compliance with its statutory requirements. And with that, I turn to my distinguished co-chair, Senator Grassley.
Thank you. Thank you very much. Thank you particularly for examining through this hearing the Office of National Drug Control Policies, coordination of national drug control efforts, and preliminary review of the drug control strategy by the government watchdog GAO. Congress creates agencies like this one. Congress appropriates money for agencies like this one. Congress, from time to time, passes laws for people to carry out, and so we're doing today our constitutional responsibility to make sure that the executive branch of government and this agency specifically carries out our laws according to congressional intent as required by the president to faithfully execute the laws under the Constitution. ONDCP was created to serve as our nation's leader in combating drugs. Since the inception in 1989, the threat posed by drugs have evolved. But the mission of the ONDCP and of this particular group of senators, the Drug Caucus, remains the same: to save lives. This hearing comes at a critical juncture for our nation. We're in the middle of the most destructive and most challenging drug environment that this country has ever seen. By now, we've all seen the numbers. So I quote again similar numbers to what the chairman quoted. The Center for Disease Control and Prevention reported that nearly 108,000 Americans died last year from drug overdose. This is staggering, and this ought to be unacceptable to any senator or any citizen in this country. Iowa's no longer no stranger to the drug crisis. Our towns and communities have been hit hard by the impact of lethal drugs. This includes meth, fentanyl, and now the spread of the deadly counterfeit pills. Fentanyl overdoses have become the #1 cause of death among U.S. adults 18 to 45. Overdose deaths from methamphetamine have tripled in recent years, according to the National Institute of Health. Common sense tells us that we need ONDCP to lead efforts and steer a national strategy that makes it harder to obtain and use fentanyl and its analogs, as well as meth, synthetic opioids, and any drug. We need to be focused on stopping the spread of these drugs, but I think ONDCP's 2022 strategy could do better at that. The strategy doesn't put enough emphasis upon scheduling fentanyl analogs permanently. Also, tackling counterfeit pills laced with fentanyl and meth is hardly even mentioned in the strategy. I'm concerned that the strategy's emphasis on harm reduction could allow for an even greater use of drugs. I'm also concerned that the strategy notes that ONDCP will take a review of where mandatory minimum sentences for drug offenses should be eliminated. This guiding document sets the tone for how our nation perceives drug policy and calls our federal and state partners to action. I'm worried that making drugs more accessible is what this administration calls drug control. I'd prefer if the strategy focused on the most lethal drugs facing us. We need to take and make it harder to get and use drugs and find areas where we can get real work done. I have a few ideas on that subject. The permanent scheduling of all fentanyl-related substances is just a mere start at my strategy. The ONDCP has supported class-wide scheduling of fentanyl analogs, and I hope that's still the case. Second, the Methamphetamine Response Act that I introduced with Senator Feinstein is now law, and I look forward to working with ONDCP on its implementation. Also, Congress can continue supporting prevention efforts like educating parents and children to stop access and use of drugs. But there's more work to be done. I look forward to hearing from the director today and discussing how we can work together to turn the tide. Thanks again to our witness for being here today, and I look forward to your testimony. Thank you.
Thank you. Let me thank Senator Hassan for joining us and recognize Dr. Gupta for a 5-minute statement followed by our questions. Dr. Rahul Gupta has been a practicing primary care physician for more than 25 years. He served as West Virginia's health commissioner under 2 governors through the state's opioid crisis and led pioneering public health initiatives in that capacity to help with the crucial problems that West Virginia faced. He has had several academic positions, including Chief Medical and Health Officer and Senior Vice President at the March of Dimes, and comes to us from a distinguished academic background. Dr. Gupta, welcome. Please make your statement, and we'll proceed after that with our questions.
Thank you. Good afternoon, Chairman Whitehouse, Chairman Grassley, and members of the committee. Thank you for inviting me today to testify about President Biden's inaugural drug control strategy. The strategy was released in a time of unprecedented challenges. For far too many years, the overdose crisis has been unraveling the very social fabric of our nation and destroying American lives and livelihoods. The Centers for Disease Control and Prevention estimates that overdoses have claimed more than 1 million lives over the past 2 decades. Now, in 2021 alone, as we mentioned today, we've lost more than 107,000 Americans. That's 1 life being lost every 5 minutes. These are our friends, our neighbors, our family members, and coworkers. Since 2015, overdose deaths in America have more than doubled, and the COVID pandemic has amplified the existing difficulties in accessing treatment for substance use disorder. As a practicing physician for the past 25 years, I've treated many patients with addiction who have gone on to lead successful lives in recovery. But I've also seen too many patients succumb to their disease and have attended far too many funerals. Working in the emergency room, I experienced weeks and months where I was reversing overdose every single shift. Now, behind these fatal overdoses, there are millions of individuals experiencing non-fatal overdoses that are overwhelming our first responders and the healthcare system. Underneath these overdoses are tens of millions of Americans suffering from substance use disorder. There are other effects as well. Research estimates that the economic cost of this epidemic to be a staggering $1 trillion a year, and up to 26% of the loss in U.S. labor force participation can be attributed to the disease of addiction. Addiction and the overdose epidemic is a nonpartisan issue, which is evidenced by the fact that it touches everyone, regardless of where you live or how you vote. And this is why ending the opioid epidemic is part of President Biden's unity agenda and why it has strong support across the country and across political parties for finding comprehensive and meaningful solutions. As the Office of National Drug Control Policy developed this strategy, we focused on the fact that this epidemic is being driven largely by untreated addiction and drug trafficking profits. The strategy's 7 goals focus on reducing substance use, overdose deaths, and the supply of illicit substances, and increasing prevention, harm reduction, treatment, and recovery efforts, and finally, improving the way criminal justice system addresses substance use disorder so people can get the help they need before it's too late. There are also 4 key priorities that cut across the strategy. At a time when 3 out of 4 overdose deaths involve opioids, it is critical that we're making sure that everyone can access naloxone. We're also working to ensure that everyone can get substance use treatment. We're disrupting drug trafficking operations, and we're moving data collection, particularly for non-fatal overdoses, as they are a pretty good indicator that someone will experience a future fatal overdose. Now, taken together, these goals and priorities usher in a new era of drug policy that is comprehensive, holistic, and targeted at saving lives first. At this moment in history, our nation is at an inflection point. Our actions must rise to the occasion by being bold and innovative, but also compassionate and consequential. The Biden-Harris administration's inaugural national drug control strategy is an unprecedented response, evidence-based, and the blueprint is designed to save lives immediately, build the infrastructure for treating addiction our nation so desperately needs, and disrupt drug trafficking and the profits that fuel it, all the while ensuring the federal government is accountable and serves as a good steward of taxpayer dollars. Saving lives is our North Star because I believe that every life is precious and worth saving. If this strategy is implemented as indicated and intended, we could save 164,000 lives over the next 3 years and help tens of millions of people get into treatment and on path to recovery. The President and I are committed to seeing this through because American lives depend on it. Thank you for your continued efforts to make our country safer. And as President Biden said, let's come together to beat this. I look forward to your questions. Thank you.
Thank you, Doctor. One of the things that you did in West Virginia was to create overdose review teams. I think you called it opioid autopsy. What should I should flag that Senator Cornyn and I have a bill on this, the Overdose Review Team Act. How important is it for the federal government to support overdose review teams?
Thank you, Mr. Chairman. It is very important that we understand the science and the data behind millions of people suffering non-fatal overdoses, because what we found in West Virginia, 4 out of 5 people came in contact with the healthcare system before they died. It's us who failed them, not the other way around. So we've got to figure out what's happening to people in communities, in neighborhoods, and be able to solve those issues at that level.
We have done a good job, I think, in Rhode Island trying to make sure that anybody who comes into an emergency department with an overdose is assigned to a peer recovery specialist. It doesn't always work. They don't necessarily always want to talk, but the opportunity is there, and I think it's made a big difference, and we look forward to working together to get our bill passed into law. Telehealth was something we learned a lot about through the COVID epidemic, and we want to make sure that the capacities and flexibilities of telehealth that were established during that period continue. Do you support the continuation of telehealth flexibility in opioid treatment?
Yes, Mr. Chairman, I think one of the great things that has happened from the first year, right from the first day onwards of this administration, is providing that flexibility to communities in being able to provide telehealth as one of the ways solutions. The strategy, make sure that that happens and continues to happen, because getting to remote areas, especially rural areas, is very critical, and telehealth is one way to get there to help advance treatment.
We had enormous success in Rhode Island with our incarcerated population reducing deaths by over 60% by beginning treatment pre-release and seeing to it that there were supports post-release. Are you comfortable that the Bureau of Prisons has stepped up as it should to deal with the population that is exiting incarceration and reentering society?
Yes, Mr. Chairman, there's a lot of work happening that I know of right now with Bureau of Prisons, DEA, SAMHSA at HHS, and us working to lead that effort to ensure that we can walk the talk when we talk about universal treatment. So we're working aggressively to make sure that we have systems in place where no one within the federal correction system is denied treatment, because we know that has a direct impact on society, both in terms of reducing recidivism, reducing overdose, and improving the cost. It's just the cost of the system that it costs us. So,
are you satisfied with the Bureau of Prisons response?
Yes, so far we have a great working relationship. I'm looking forward to having a significant amount of success in this.
This is probably more our problem than yours, because at its heart it's a funding problem and we provide the funding. But everywhere I go around Rhode Island, I hear the same concerns about workforce, and particularly in the caring professions workforce, whether it's healthcare or elder care or child care. And it's particularly acute, I think, in mental health and in substance treatment. And in part, I think we take advantage of people who, for reasons of personal commitment, are willing to operate in jobs that they're compensated far less than they're worth, but their sense of inner motivation keeps them there. But it really isn't fair to them to take advantage of that and not pay them salaries that are worthwhile. What do you think the key steps are that Congress should take to support the substance treatment workforce and to make sure that salaries are commensurate with the kind of service they provide?
Thank you, Mr. Chairman. Clearly, the importance of workforce in addiction is important. We have 23 million Americans that are in recovery today, so peer recovery support groups are important. There's a lot of work happening within the part of the strategy, which is making sure we have apprenticeship, loan repayment programs. People get support to serve in underserved areas, folks with licenses, but other workforce that we're going to need in terms of social workers, and making sure we have navigators. All of those things are going to be very important.
And they're part of the focus of your strategy?
Yes, yes, Mr. Chairman.
So last question. There are two sides of the business of international drug trafficking. One is producing and distributing the unlawful drugs themselves. The second is collecting the money that you get paid at the sale and bringing it back and then investing it or putting it to use in whatever ways. My experience as a prosecutor has been that we put an enormous amount of effort into the first part of the business, much less effort into the second part of the business. And in my view, the second part of the business, the financing of international narcotics trafficking, is enabled by a structure, an international structure of dark economy that can hide the loot of kleptocrats, the funds developed by criminal trafficking networks, whether it's human trafficking or drug trafficking, terrorist financing. And I hope that as you look at the financing side of these international networks, you are attentive to this larger question of the common infrastructure that all of these evil efforts use in order to obscure where they've got their money, to hide that they have the money, to avoid taxes and accountability. We need to have a very significant moment of international transparency, and I think that will redound very effectively into our enforcement against international traffickers.
Thank you, Mr. Chairman. One of the top priorities, one of the top 4 priorities is what we are now calling commercial disruption. That involves looking exactly at these businesses as commerce and going after their profits. Going after denying them the profits helps us make sure that we're removing the real motivation behind their model first. And secondly, we're disrupting their operating capital. That also works to dismantle and disrupt their functioning every day. Part of that's been the executive orders that President Biden signed in late December. We have already had sanctioned about 26 individuals and 17 entities since, all of which are fentanyl related. Many of those tranches include the Sinaloa and CJNG cartel members. And the whole idea is exactly that, to go after the both in the production of it, but also the proceeds. So now we're able to go after not only the traffickers, but their financiers, their enablers, their trust agents, their lawyers, their accountants. All of that activity is going on. Thank you.
Senator Grassley.
Thank you, Mr. Chairman. Director, you hold an important role in our common goal to reduce illicit drug use. Your success is of utmost importance as our nation is experiencing what you've heard from both of us, record-breaking deaths from overdose. We know that fentanyl and its analogs are driving the surge in drug overdoses. I'm invested in making sure that fentanyl analogs are permanently scheduled, and I think you are too as well, since ONDC sent Congress draft legislation last year that places fentanyl drugs in Schedule 1. It contains other provisions like encouraging research. I could probably work with you on that part of it. Unfortunately, it also includes problematic policy choices of removing mandatory minimums for fentanyl traffickers, which doesn't have sufficient support in Congress. As you know, the authority to control these drugs expires at the end of the year. So can you give us an idea of your approach to making sure that permanent class-wide scheduling solutions happen by the end of the year?
Thank you, Mr. Chairman. We are really serious about making sure that the scheduling of fentanyl as a class is important, fentanyl-related substances. Having said that, as a class, I could tell you the physician is a unique and interesting way to schedule substances. With it brings a lot of complex factors, and that's exactly the reason the administration's proposals proposed scheduling fentanyl as a class, but also balancing that with civil rights and this research part. That proposal is in Congress's hands. We would love to continue to work with you and your office and your staff to figure out a path forward, but it is imperative that we continue to find a permanent path forward.
Why don't you give me a rough idea of what some of those things are that are a problem for just a simple thing that Congress has been doing 4 or 5 times on a piecemeal basis for 2 or more years, making it scheduled?
When we look at the entire class, Senator, what we don't know is what the future will hold. There may be inert compounds, but there may be others that may not be subject to be active compounds. We want to be careful, first of all, that those are included, but also they are cautiously included as a class. Secondly, you know, the notion of the idea of the sentence guidelines does not apply to serious bodily injury or death investigations. And what I've seen in West Virginia, you know, it allows more flexibility for judges to be able to judge. Now, having said that, we would love to continue to work with your office to find a path forward.
Some critics of class-wide scheduling think it could undermine research with potential benefits of fentanyl drugs, but interagency bill that you shared with Congress has both scheduling and research provisions. Can you explain how research into fentanyl drugs is still possible while permanently controlling them?
Senator, are you asking about the proposal, part of that proposal, or research separately?
Well, they are together. So since it's in the legislation, it seems to me that we can permanently schedule them and also provide for the necessary research. It seems pretty simple to me.
We believe that research could be provided. I think research, good innovation and research would help in the future to create the next naloxone, potentially, the next treatment. So I do think that research can be done on that. That's exactly why the proposal included having research as a component of the permanent scheduling.
National Drug Control Strategy is mandated by federal law. GAO did a review. It noted that ONDCP was delayed in publishing the strategy this year and that you've yet to release documents that are part of the 2022 strategy. Specifically, the missing documents are a 5-year projection of the National Drug Control Program and budget priorities, along with an outline of specific resources needed to implement the Southwest Border Strategy. Why did you fail to meet the statutory deadline for releasing the strategies, and when will ONDCP release the documents to more effectively address the drug crisis at the Southwest border?
Thank you, Mr. Chairman. When I came into the office as a physician that's worked on the ground with people, my first goal was saving lives, and I wanted to get this strategy right. It's very important for the American public that we worked on saving lives and get this right. And that's exactly what I did. I went back and looked at the entire draft that was available, made changes, went through the interagency process, had 2,000 consultations with stakeholders, all 50 state governors, as well as the interagency partners. So to me, it's more important to get it right because lives are at stake. And indeed, just today, CDC has released numbers that are showing for the first time, we're seeing smaller numbers increase, but also few hundred fewer deaths than the last time this report was released. So it is important. Now, on the path of the question of the other documents, we are constantly working very closely with GAO and our interagency partners. I am committed to working to release those documents as early as possible, and I will continue to work. You have my commitment to work with your staff in Congress to get those out.
You must have a timetable you want to get it done, or it'll never get done.
I will get that to you very responsibly, very quickly.
Okay. I've heard from families, parents, IONs as well, about counterfeit pills laced with fentanyl or meth. Drug networks are mass-producing fake pills, falsely advertising them, most often to young people. You know the deadly results. As a parent, grandparent, this is troubling since young people are susceptible to online marketing of these deadly pills. I recently introduced a bipartisan bill that closes loopholes and supports enhancement for spreading laced counterfeit pills. Also, DEA is leading a campaign to raise awareness on this issue despite the seizures of laced pills skyrocketing and pills being available in every state in the country. It doesn't seem like ONDCP is tackling this issue head on. For example, when I searched the 2022 strategy, the phrase counterfeit pills came up 4 times. Compare that to the phrase harm reduction, which was mentioned 198 times. So, Mr. Director, how are you going to refocus efforts to stop the spread of deadly illicit counterfeit pills, and how can Congress do to support your effort?
Thank you, Mr. Chairman. I think the counterfeit pills is a real challenge in front of us. It is all populations that they're looking at to getting non-prescription pills, and this has become very dangerous in terms of drug supply. Especially every life loss is tragic, but especially when it's a child, it breaks our heart collectively. I think the important thing here is that along with DEA, and thank you for looking to work with DEA and us on separate pieces, we're looking to, along with the One Pill Can Kill campaign, working with social media companies to make sure they're holding themselves accountable for the distribution. We're also working with various other law enforcement agencies to make sure that we know what that e-commerce market is. Postal Services is working with e-commerce as well to look at that supply chain. And those things are happening as we speak, but we can do much more in terms of making sure that parents, school teachers, neighbors are aware the danger of these counterfeit pills because they are a true danger in our communities.
Senator Hessen.
Well, thank you, Chairman Whitehouse and Co-Chair Grassley. And thank you, Dr. Gupta, for being here. And I just wanted to express my support for the work that Senator Grassley has been doing. We've been working together on getting fentanyl permanently scheduled, and it's something that we all have to find a way forward on. And Doctor, it was really good to have you in New Hampshire recently to see both the problems that we have on the ground as the epidemic of substance misuse continues, as well as what we're doing in the Granite State to address the drug crisis, and I really look forward to welcoming you back again. I want to start by just talking a little bit about the issue of fentanyl precursors in particular. I've worked with my colleagues to pressure China to take additional steps to regulate fentanyl analogs and fentanyl precursors, which are the chemical components that make up fentanyl. While there has been a drop in fentanyl trafficking directly from China to the United States, we've recently seen a rise in fentanyl precursors coming from China, going to Mexico, where fentanyl is now produced, and then it's smuggled into the United States that way. How is ONDCP coordinating efforts among the various federal law enforcement agencies to improve efforts to disrupt drug smuggling from Mexico and precursor chemical shipments from China and India to Mexico, where the drugs are manufactured?
Thank you, Senator, and it was indeed a pleasure to be able to visit New Hampshire and see a lot of great work that is happening on the ground. Very impressive. With respect to China, we have a long-standing counter-narcotics relationship that is currently showing uneven progress. The fact is that I echo the words of Secretary Blinken that said, you know, we often have to compete with China, but this is an area where we can cooperate. Right. And we are working very closely. I have regular conversation with Ambassador Burns, our lead diplomat in Beijing, about, and this is very high on his list of priorities, which is we have very specific asks of China to contain these precursor shipments, to make sure that they're following the international norms in shipping and labeling, and we're cooperating on these dual-use chemicals coming to Mexico or United States. It is important that we continue to hold them accountable as a global leader. If that's what they want to be, they have to take lead on these issues. With Mexico, we have invested over the years a lot of resources as well as a lot of other aspects of expertise with Mexico. Similar to, it's a shared responsibility with the Mexican government. It is important that the amount of resource as well as energy we have spent, both in gun trafficking, as example, southbound, as well as cash flows and other aspects, that we continue to have dialogue, how we can have the same level of cooperation and enthusiasm with us. I was in Mexico my first week in office. We met with the military as well as the Addiction Council, and we continue to believe that the bicentennial security agreement that was signed between two countries on public health, security, and community safety will be an important path forward.
And just following up a little bit, has there been outreach and work with India in its role with precursors as well?
Yes, India is a promising and improving global counter-narcotics relationship. We are having the third meeting of the counter-narcotics with India. Our team, ONDCP, will be traveling next month there to have a high-level agreement on some of the goals. That includes not just precursor shipments, but also of other opioids like tramadol, tapentadol, and those type of substances as well that we're seeing shipments of here.
Okay, thank you. I was heartened to see that the 2022 strategy highlights the importance of medication-assisted treatment in treating substance use disorder. How does access to medication-assisted treatment factor into your treatment and recovery benchmarks?
Thank you, Senator. The fact is today, a fraction of the Americans who need treatment are getting treatment. Part of this is stigma, and part of this is really the inability to get treatment and access treatment. Us looking at having universal treatment access by 2025, increasing treatment behind the walls, and making sure that those drugs are available to all people is very critical, because that allows people, first of all, not to die, second of all, get into treatment, and then get on to recovery, so they become productive part of this nation's economy. As we talked about, there's a lot of loss, economic and labor force participation loss, that is attributed to addiction and substance use.
Well, thank you. That's exactly why I introduced the Substance Use Prevention, Treatment, and Recovery Act to reauthorize and improve the Substance Abuse Block Grant. It's a bipartisan bill with Senators Murkowski and Lujan, which would provide desperately needed resources for communities grappling with the substance use disorder crisis, and to help ensure that all efforts to address the crisis are based on what we know is effective and lasting. And I think one of the things you just talked about, the stigma, there's still more work we can do to really help people understand that medication-assisted treatment is the gold standard at this point and really is effective. Last quick question. Several cities and regions are seeing an increase in new synthetic opioids that are even more powerful than fentanyl, which is, from what I understand of the power of fentanyl, kind of hard to comprehend. How is ONDCP working with scientific and law enforcement organizations to develop and deploy field testing kits that are able to detect these new, even more dangerous synthetic drugs?
Thank you, Senator. We know that with synthetic, there's a very important shift that has happened recently in the drug policy world, shift from plant-based to synthetics.
Right.
And with those synthetics, Pandora's box has been opened. We can expect to see much more potent substances. So it's really important for us to continue to work with the scientific community to understand, and that's why part of the harm reduction agenda is also be able to have that drug checking ability to understand what's in people's drugs, so we have an idea of what is prevailing and looking at those emerging threats and acting before it's too late. So we're looking forward to that.
And having a system that's agile enough so that as the synthetics are changing, as the compounds are changing, the testing mechanisms can change quickly and be produced quickly, right?
Yes, Senator.
Thank you very much. Thank you, Mr. Chair.
Thank you, Senator. Thank you very much, Dr. Gupta. There will be questions for the record from those of us who are here and also senators whose schedules prevented them from being here, so I hope you'll promptly answer those questions and look forward to continuing this discussion. I would like to have a separate briefing at some point on the question of sanctions and how you see that working into this, but that's to be scheduled later, if that would be agreeable to you.
Thank you, Mr. Chairman. Really looking forward to having that briefing, and we will get those questions to you very timely. Thank you.
Terrific, much appreciated. We will now move on to the second panel, and our witness for the second panel is Triana McNeil. She is a director in the Government Accountability Office's Homeland Security and Justice team. She oversees issues related to federal efforts to counter domestic terrorism and violent extremism, domestic intelligence and information sharing, and law enforcement efforts to combat drug misuse. Ms. McNeil joined GAO in July 1999. She has a master's degree in public administration from George Washington University, and I'm delighted to have GAO and Ms. McNeil specifically here today to respond to our questions. You have 5 minutes to make your opening statement, and then we will proceed with the questioning. Thank you.
Thank you for having me here today. Chairman Whitehouse, Co-Chairman Grassley, and members of the caucus, I am pleased to be here today to discuss GAO's preliminary findings on the 2022 National Drug Control Strategy, progress made by ONDCP, and critical steps that it needs to take to address deficiencies that we have previously identified. When we determined this long-standing and persistent issue was high risk in 2020, 93,000 people died in that same year from drug misuse in the U.S. The most recent data show that over 107,000 died in 2021. 107,000 people's families and communities lost their loved ones last year. ONDCP's role is critical to helping prioritize, coordinate, and measure key efforts to address the drug crisis. ONDCP is required to do a number of things based on the Support Act. It's required to develop the strategy, it's required to work with agencies to develop an annual drug budget, and as you know, this year's budget was over $39 billion. The Support Act calls on ONDCP to, among other things, determine comprehensive, long-range, quantifiable goals, identify annual measurable targets for each goal, provide an estimate of the needed funding to achieve each goal, and describe a performance evaluation plan to track the progress for each goal. Based on our preliminary analysis of the strategy documents released to date, more are forthcoming, we all know that, we found that the strategy addresses some, but not all of the statutory requirements. For example, it contains information on those comprehensive goals. It does identify annual measurable targets, but it does not contain any information on the necessary funding to achieve those goals or any information on a performance evaluation plan to track the progress. Moving forward, we will continue reviewing the remaining documents that will complete the strategy once they are issued. We will look for that funding information, we'll look for that plan to assess the progress, and more details on how these goals will be operationalized. And I want to underscore the evaluation piece. We need to know what we are achieving and we need to know where to refocus our efforts. All of these are critical pieces to effectively tackling this drug epidemic. Chairman Whitehouse, Co-Chairman Grassley, and members of the caucus, this concludes my prepared statement. I'd be happy to respond to any questions at this time.
Thanks so much, Ms. McNeil. I appreciate very much you being here. One of the things that you all are very good at is data collection. And one of the problems that has been identified in this area has been data collection. And so I'd like to ask you a little bit about that, potentially in the context of the performance evaluation plan you mentioned, but also more generally. I proposed an amendment with Senator Hassan to the FY22 NDAA called the NARCO Act, which would direct the Department of Justice to collect data from National Drug Control Program agencies based on concern that is echoed in the strategy that our data systems lack the timeliness, scope, and precision required for the most impactful national response. There is a recommendation that a drug control data dashboard should be established. Could you give us your overview of where we are on data collection and what the key steps are that GAO would recommend to try to make the improvements that are necessary?
Sure. I can speak to a few suggestions and provide some updates on the status of those recommendations. Both of the recommendations on the data dashboard are still open. They are not addressed. We have been working with ONDCP since 2019 when we made those recommendations. They've been very forthcoming in terms of what they plan to do, and so we are just engaging with them just to make sure we have the latest information. There's still a serious lack of information. There are limited information on fatal and non-fatal ODs. There is limited information on the known and estimated flows of drugs into the U.S. There is limited information on the unmet treatment needs. These are still the same issues that we've been dealing with for the last few years. And I think that it's important to kind of look at what the Drug Data Interagency Working Group is planning to do. They are the one that is going to be leading this effort to tackle these data issues. That's an effort that was outlined in some of the documents that ONDCP has recently put out. But I do want to just put a few things on the table, and we will continue to share this type of information with ONDCP. There are models for central repositories that we've identified that ONDCP can look to. This data dashboard is supposed to be publicly available, searchable. The data should be quality. It should be reliable for all different levels of government and researchers, private folks to use. So they can look at the Department of Education's EdFacts as a model. They can look at OPM's Enterprise Human Resources Integration as a model. And they can look at Bureau of Labor Statistics, Data Finder, and Data Tools. These are good models that are just practical examples that they can think about leveraging as they build out this data dashboard. There's some other information that I would like to share, and we will be providing this to them on data governance, just some key practices when you're trying to develop a central repository, developing data standards and managing to that, making sure that you get input from your users. What do they need? And how best would they like that information to be provided? How would it be most usable for them? And then invest and maintain an infrastructure for that information. You can't just build it and leave it. You really have to manage that and invest in that upkeep.
Should there be a bigger role for the Department of Justice in the data collection, given its practical role in investigations and prosecutions, and given the strength of its sort of policy development component?
I think it's fair to say that all the drug control agencies should be partnering with ONDCP and providing all that necessary information.
I'm just wondering who should be the lead. I hear the term interagency working group and I shudder. Because while interagency working groups can be effectual, they are also often places where initiative, accountability, and punctuality go to die In fact, we should probably do a GAO report on interagency working groups at some point, but that's a separate
We've
matter.
got criteria on that as well.
Yeah, I mean, I shudder with fear when I hear that an interagency working group has been set up to do something, because I don't think I'm going to see anything again on that for years. But we'll continue working with you on how this should be set up. As you know, Senator Hassan and I did a bill that raised the responsibilities of DOJ. I think that that is probably sensible, but why don't we continue that conversation at the staff level and try to get that sorted out? And with that, let me yield to my distinguished colleague, Senator Grassley.
Thank you and welcome, Director McNeil. Your agency maintains a list of high-risk programs that are vulnerable to waste, fraud, and abuse. January 2021, GAO added, quote, national efforts to prevent, respond to, and recover from drug misuse, end of quote, to this list. GAO cited several issues such as a need for greater leadership and coordination of the national drug control effort, strategic guidance that fulfills all statutory requirements, and more effective implementation and monitoring. This seems to fall under ONDCP's purview. So this question, three short questions, but I'll give you one at a time. Why is being on the high-risk list problematic?
Being on the high-risk list provides visibility. So when you have an intractable issue such as these epidemic record number of overdose rates and drug misuse rates, having that on the high-risk list provides visibility. We're invited to hearings like this. The director is invited to hearings like this, and it just continues to just put the spotlight on an issue that really needs to be resolved. And it also puts pressure on those involved to come together and really try to tackle the problem. Because every 2 years, we put out a report and we report out on progress made or not made.
What efforts is ONDCP currently taking to remove these items from the high-risk list?
So the drug misuse issue is on the high-risk list. ONDCP is not on the high-risk list. It is a whole-of-government approach that is going to need to be taken to remove this issue from the high-risk list. We focus on a number of things. One thing that we did need to re-educate ONDCP about is it's not just about closing our recommendations. That's an important part of this. But if we don't see increased capacity, for example, understanding what's needed to meet the treatment needs, making sure that that treatment is met. There's other capacity. We had a recommendations toward DEA for improved data analytics. They had a lot of information about suspicious opioid orders, but they weren't mining that information. So having that capacity to be able to look at all these different areas that can positively affect the issue is what we need to see. But I also will say, if these rates don't decrease, it's not coming off the list.
I think you just answered the third question. I'm going to ask it anyway, and you tell me you just answered it. I think you did. What will it take for GAO to remove drug misuse from the high-risk list?
We'll need to see a marked decrease in the rates of overdose deaths and drug misuse, number one. We'll need to see a fulsome action plan in this strategy. And so when these documents come out later in the summer, hopefully that's when we'll see the last remaining two, we'll evaluate those. If there's not the resources tied to each of those goals, if there's not a performance evaluation plan that clearly is assessing the activities that they're prioritizing, that's going to be a problem for us. Those are just some of the things, but I think sustained leadership is also going to be key there.
This year's strategy is different from past strategies in a few ways. It covers a somewhat controversial topic of harm reduction, focuses more on racial equity, and ignores pressing issues like scheduling fentanyl analogs or dealing with deadly illicit fake pills. Given the widely cited statistics about overdose rates, what about ONDCP's strategy is troubling, and how can the agency improve their drug control efforts moving forward?
So we have not reviewed the strategy in this way before. When we've reviewed the National Drug Control Strategy, it's been the complete strategy. So this is an early look at the documents that they've put out to date. So in these last remaining two, there's a lot of promising things that they said will be contained in these two documents. So I hesitate to say that this strategy is lacking XYZ. I can speak to these 6 documents that they've issued thus far that's lacking some critical information, and it goes back to the same themes. What money are you gonna need? What are some specific activities tied to each goal? How are you going to assess that? And then how are you going to use that assessment to inform the next strategy? How are you going to redirect activities and funding toward things that are working and away from things that aren't working? Those are the critical pieces that we're looking for. And we will look for that this summer in those documents if they come out.
This will be my last question, then I'll submit others to you for writing. You mentioned in your testimony that ONDCP hasn't provided details on how to achieve its border strategy goals. This is concerning since we know that the majority of drugs killing Americans originate abroad and come across the southwest border. Has ONDCP been engaging with GAO on rectifying this error, and why is fixing this so important?
No, we have not specifically engaged with them on the border strategies. This is something that we will be asking them information about. We're looking for some of the funding information that we noticed was a glaring detail that was not included in those strategies. But we will be having ongoing discussions with them over the summer. Mm-hmm.
Thank you, Senator Grassley. Thank you so much, Ms. McNeil. Thank you for your work. We always appreciate the support from GAO. For the record, I will say that the second scariest thing behind interagency working group is whole of government approach in terms of finding an answer anywhere in the near future. Mm-hmm. Maybe that's the second part of the GAO inquiry. This is not a question about your work here. This is a question about my understanding about your report and what we might do going forward. In my questions to Dr. Gupta, I focused on, in the area of international narcotics trafficking, the imbalance between enforcement efforts against the distribution side and enforcement efforts against the finance side. Mm-hmm. And particularly with respect to enforcement against the finance side, with understanding that not only is there the flow of funds back into the criminal enterprise, but there is also the secondary use, storage, investment, mm-hmm. whatever, of those funds, and that second part in particular tends to stand on and be supported by the existence of an anonymized international dark money capability mm-hmm. that not only supports the international narcotics trafficking enterprise, but kleptocrats, international criminals of all varieties, generally horrible people, terrorists, all around the world. And it strikes me from reading your report that those were not questions that you looked at. I just wanted to make sure that I understood that. Not yet.
Not yet. I think that that's work that we should be focusing on. I think it's important work. As you noted in my bio, I do, a part of my portfolio yep. is countering violent extremism, domestic terrorism, and we have ongoing work looking at those illicit financing of those entities. And I think we need to be doing something similar here.
good, because what I was planning to suggest to you was that we figure out how to consider doing something in that space, because I think the effort here with our national drug control strategy aligns quite well with the klepto capture initiative that has just been stood up / enhanced to deal with the problem of the Russian corrupt oligarchs, but which creates a capacity that can expand well beyond that particular target set, and which also aligns extremely well with the president's democracy initiative goal of trying to suppress that corrupt international dark economy. And if that's something that we can work together on to pursue, I don't know quite what the format is for the right request. We can go offline and
Yep.
do that, but I think that's a very important, useful thing to do. I suspect there'd be a lot of bipartisan interest in doing that. And I'd love to have there come a day when it was just as socially unacceptable among nations to be a place where you can hide corrupt and illicit money as it is to be a place where you can employ child labor. So it's obviously going to take some time to get there, and there are places that have as their revenue proposition supporting that dark economy, and in fact, unfortunately, they're actually American interests that make money off of that. So we've got a lot of work to do, and I'm glad you see those connections, and in whatever way that we can help with asking the right questions and supporting GAO taking a look into that, I would very much like to do that. I'm encouraged that you had already seen those links, so thank you.
Yep, my pleasure. I'll coordinate with the staff.
Great. With that, we are done here. Again, if there are questions for the record that you get, please answer them promptly and fulsomely. And thank you very much for your service.
Thank you.
And with that, we are concluded.